Hi everybody, Nurse Scott here. How are you? Today's video is less of a vlog, like what's going on with me, and more of a how-to. The background on this is that I had a regular YouTube channel with just my, just fun videos. My dog's doing stuff whenever I was playing saxophone out someplace. And I happened to make one video on how to give yourself an injection without pain. A painless self-injection. I myself have to I inject myself every 2 weeks with some testosterone. And it's in the muscle, and you hear people talk about, I could never be diabetic, I could never give myself shots. Well, those shots are tiny, tiny, tiny compared to what you need to do, the size of the needle you need to use for a muscle injection. But it can still be done without pain. And it turns out that that video, which was so amateurish and had goofy music behind it, I'll put a link. It turns out this little, video was my most popular by far. My stupid dog videos get like 75 views or something like that, and that takes years. This got 1.5 million views, so I realized that's what the universe wants from me on YouTube, is some practical information. And what I think, as I've kind of looked at the comments and where it's been shared and copied in a couple of cases, I think there are a lot of people who are trans and have to take hormones as part of their transition process. And that, for a lot of them, is a really difficult part of the transition. Not only changing your name on your driver's license, not only explaining things to your boss, not only, coming out, not only dealing with surgery and even being able to afford surgery. Injecting yourself on a regular basis is pretty daunting, and it was to me too when I started needing to do that. So there are a couple of tricks to do this. I'm going to demonstrate for you now, and then we'll talk about it a little bit afterwards. So here's everything that you're going to need: the medication that you're going to inject, in this case testosterone, an alcohol swab, a syringe of the right size. I'm going to be administering 1 ml, so that's 1/3 of a 3 cc syringe. You can use a smaller syringe where it only holds 1 cc. And then this is a very thick, viscous medication, so there's no way I'm going to draw it up in a tiny needle like this. I'm going to need something that's bigger, or else it'll take forever. So the first step is to clean off the top of the vial with a little alcohol. Take out the syringe and remove that needle and put on the bigger needle. Okay. Then we want to stab the vial. Turn it over. There's usually enough air in here. You don't have to inject air, but you can inject a little air in here to displace the fluid. And then we want to draw out 1 cc. So we draw a little bit more than that. Tap, tap, get the bubbles out. I've got more bubbles. And we'll find 1 ml right there. Then we can pull this out. Now, this is an old technique, but it still works. You pull back and maybe even that much air, to put that much air in the syringe. And the reason we do this is to lock the medication in place. It is not dangerous. There's an old kind of myth that injecting air into a vein, if you were giving something IV, if you injected into a vein, that air would go to your heart and give you a heart attack. Small amounts of air, even in a vein, don't cause damage. They just get dissolved into the blood. I guess a large amount of air might do it. In this case, we're not going in a vein, we're going in a muscle anyway. So this is going to help when we inject it into the skin and put it in. It's going to go fluid first and then some air, so that inside the muscle there'll be a little bubble of medication with some air at the top. And it helps to lock that in place, and so that the medication doesn't leak out of the hole that the needle makes. And you can see here the needle is much, much thinner. So when we're talking about giving a painless injection, One of the tricks is to use a very small needle. In this case, I believe it's a 23 gauge. And it's also all in the technique, which I will show you next. First, we need to find where we're going to give the injection. In the thigh, we want to put a hand here and a hand here and find the middle third of the thigh. And then we want to give it on the outer third, or at least outer half, into the muscle. And we can feel parts of the leg are very tendinous. This is very fleshy. That's a muscle. So first, use our alcohol swab to clean that area. Let it dry. It's the drying of the alcohol that actually kills the bacteria. I'm going to make sure our air is where it's supposed to be. Maybe give a little tap on our syringe. All right. Everyone wants to know, how do you do this without hurting yourself? So here's the trick. 2 tricks. Well, 3 tricks. 1, stretch that skin. You can even see it blanch a little bit here. Stretch the skin. That also is going to help it not leak out after you're done. Second, your motion needs to be a quick jab at 90 degrees, not this kind of thing. All right, but like a dart. Boom. You go so fast your little nerves won't know what to think. And the other trick is to cough while you do it. When you cough, think about it. Your whole body kind of and your brain is receiving impulse, these signals from all over the body that it's moving. And when there's that, plus this pinch, if there is even much of a pinch, it really has your brain has a hard time processing all of it at the same time. So here we go. There's my spot. It's still clean. I'm going to stretch. I'm going to jab and cough. And I swear to God, I didn't feel that. Pull back to see if there's any blood coming back, and there's not. We're going to push the medication in. This takes some pressure because it's thick, and there's the air. And then we're going to just pull it straight out. I kind of didn't go 90 degrees, did I? And then we want to rub this, see if there's any bleeding. Because I stretched it, when I made a hole with the needle and then let go, the hole closed on itself. So only one little spot of bleeding, didn't hurt a bit. Clean that up, put the needle in a sharps container, keep it safe. And with intramuscular injections, most of the time, you can rub them. This helps get rid of any soreness you might feel. And it also helps the medication kind of be absorbed into that muscle. And that is that. So that's that. It was pretty easy. Of course, the more you do it, the easier it gets. If you can overcome that fear at the very beginning, I mean, it's only natural. We don't want to, hurt ourselves. If we were supposed to hit ourselves on the thumb with a hammer, I think all of us would be kind of hesitant to do that. And this seems like the same kind of thing as putting a needle in ourselves, but it doesn't have to be. Remember those tips. 1, stretch the skin. You've got nerve endings in your skin, and when you stretch it, they stretch with it, and you're going to hit fewer of them. It also, kind of numbs them when they're stretched like that. And also, when you make a hole in something that's stretched, when it comes back together when you're done, that hole closes up. You're going to have much less bleeding. The second tip, jab like a dart quickly. I've been giving IM injections, intramuscular injections, for years and years and years, and this is how I've always done it. And I cannot tell you the number of times people have said, "Wow, really? That didn't hurt." I'm like, I can do it again if you feel like you're being shortchanged. And they laugh and they go, "No, no, 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 no." Jab it in. That's number 2. Number 3, cough. I don't know where I found this little tip, but I did, and it's great. When you cough, like I said, just to review, your body vibrates, and your brain is trying to process all these signals. And when it suddenly gets signals from the whole body, hey, there's movement in the whole body, plus a signal going, ouch, there's a pain in my thigh from a needle, it has to kind of make sense of all those like on the spot. And a lot of times, especially when you jab and when you stretch, that signal kind of gets lost in the noise of the cough. That's my best explanation for why that works. So if you need to inject yourself intramuscularly, this is how you do that. Some of the same kind of things can be said for subcutaneous injections like insulin and some other things. But this, just so you know, is specifically for intramuscular injections. So please, if you're trans, I hope this helps you with the transition. I hope this helps you, do what you need to do to live your best life. If you are on hormone replacement therapy as a man like I am, I hope this helps you. Please share it with anyone you think will find it useful. Make sure to like this video, that helps me. Subscribe if you want to see more videos and you'll be notified when they're available. Click the bell so you'll be notified. And thanks for watching, and I'll see you next time.